Phantom limb pain is pain coming from the body part that is no longer there. Some injuries that result in phantom limb pain are spinal cord injuries, congenital limb deficiency, nerve avulsion, and the most commonly known is amputations.
According to research done on phantom limb pain, there is not an exact explanation that pinpoints a specific area of the brain that causes this phenomenon. From the research that has been done, though, the main area believed to be associated with phantom limb pain is the sensory motor cortex, which is right here on our brain model. The sensory motor cortex functions in processing movement and touch. The main job of this cortex is to process sensory information and relay that into movement. The reason this is believed to cause phantom limb pain is due to faulty rewiring of the cortex. By this we mean that there is a mismatch in the signal between a movement and the perception of that movement. As a result of this faulty rewiring, the pain signals go elsewhere, creating perception of the pain elsewhere in the body.
Common symptoms of phantom limb pain include burning, shooting pain, pins and needles, twisting, crushing, and electric shock sensation. Other symptoms include temperature changes, vibrations, itch, pressure, movement, and the pain also comes and goes. An interesting fact about phantom limb pain is that if the amputation was not immediate, or if an extreme amount of pain led to the amputation, the amputee is more likely to develop phantom limb pain. This is because the amygdala stores the memory of the pain, which can cause reoccurring pain to occur.
The onsets of symptoms that Kelsey had just talked about may occur within the first week, but may be delayed for months. There are common triggers for these symptoms, such as touch, urination, sex, angina, smoking, and
Mirror therapy is a treatment option used for unilateral amputees. It uses a mirror box to project an image of the intact limb. The idea is to trick the brain into believing that the amputated limb is whole and healthy. The patient sits with a mirror facing their remaining leg. They then move the leg and watch the reflection in the mirror. This tricks the brain so that it appears that both the healthy and the amputated leg are moving. It has been found that what we feel comes from the brain, including painful sensations. Phantom limb pain shows that while what we feel can be influenced by inputs from our body, the brain's system of processes can act or influence pain receptors even when pain is not present. Everything we experience comes from neural networks in the brain. It has been hypothesized that this hardwired process in the brain causes pain in the absent limb due to the brain attempting to move that limb. This sends abnormal inputs and ultimately results in pain. Mirror therapy makes the brain think that the limb is moving fine on its own and doesn't need these abnormal inputs to make the limb move. Mirror therapy has been proven to decrease opioid use, overall pain, and allow patients to continue on with their everyday activities. While many other treatment options have been found to help patients with phantom limb pain, most still require medications to ease this pain. There are many different types of medications prescribed to phantom limb patients, and each plays a different role in the symptoms that the person may experience. Phantom limb patients may be prescribed non-steroidal anti-inflammatory drugs, or NSAIDs, opioids, antidepressants, anticonvulsants, and muscle relaxants, along with sodium channel blockers and NMDA receptor antagonist drugs. NSAIDs and opioids are prescribed strictly for pain management. Muscle relaxants help to reduce skeletal muscle spasms, relieve pain, and increase mobility in their affected limb. The two major medications used to treat phantom limb pain are antidepressants and anticonvulsants. Tricyclic antidepressants are often prescribed to phantom limb patients to produce an analgesic effect. They work to decrease pain by inhibiting the serotonin norepinephrine uptake blockade, NMDA receptor antagonists, and the sodium channel blockade. Like antidepressants, anticonvulsants are also used to treat neuropathic pain. They are often taken in combination with antidepressants to increase this effect.
Another treatment that is being used for phantom limb pain is acupuncture. This form of acupuncture that works specifically in helping patients experiencing phantom limb pain is neuroacupuncture. This is a neurological form of acupuncture that stems from the insertion of needles into the scalp. This type of acupuncture is what doctors have seen the most results with in treating phantom limb pain. The needles are inserted into the areolar tissue layer of the scalp. Here, they stimulate the brain neurons of underlying areas. Studies are still being done on how this treatment exactly works in helping these patients, but are leaning towards the idea of nerve regeneration. The results of the treatment rely on the individual themselves, the recency of the injury, as well as how severe the injury is or was. Treatment takes about an hour for 2 to 3 times a week. One course lasts about 10 full treatments. In a case study done on acupuncture treatment for phantom limb pain, a 59-year-old man presented with chronic phantom limb pain after his foot was amputated 21 years prior to this treatment. Cranial acupuncture was performed, hitting 3 points on his cranial nerve. After the patient had undergone treatment, he reported decreased intensity of his pain to minimal or none after 13 weeks. After 16 weeks of treatment, the duration of the pain decreased from 13 hours to 30 seconds, and the frequency of the pain decreased by 50%. Although research is still being done on this form of therapy, phantom limb pain is widely treated with acupuncture. TENS unit therapy is another form of treatment used for phantom limb pain. A TENS unit is what you see pictured here. It is a battery-powered electrical device in which electrodes are attached to the patient. An electrical current is generated and delivered into the skin, which activates the underlying nerves in that location. These electrical impulses flood the nervous system, which reduce the ability to transmit pain signals to the spinal cord and the brain, thus lessening pain. This stimulation of the body produces natural pain relievers called endorphins. There are 3 aspects to this type of therapy: intensity, frequency, and duration. The intensity allows a patient to adjust how strong the electrical stimulation is. The frequency is the number of the electrical impulses per second. High frequency is 80 to 20 impulses per second, which is most commonly used for acute pain, while low intensity is about 1 to 20 cycles per second, commonly used for chronic pain. Duration is the number of microseconds that the current enters the skin for during each pulse phase. While this treatment has been used for a while, medical professionals are beginning to use this treatment as more of a prevention of phantom limb pain than a treatment.
A shrinker is also known as a shrinker sock. Shrinkers are used to reduce, prevent, or control swelling in below-the-knee amputations. They are designed to fit snugly and apply pressure to soft tissues of that stump. These socks are made up of elastic and manufactured in a variety of lengths and widths are intended to shrink the limb in a more circular shape at the end. It is important that this pressure be greatest at the end and gradually lessens towards the thigh. If the shrinker is loose at the end and tighter higher up in the thigh, this will stall circulation and actually increase the swelling. A shrinker sock is to be worn continuously unless the prosthetic is on or the patient is bathing.
A fairly new method of treatment is virtual reality. The users wear an eye mask with a screen over each eye, which is similar to mirror therapy, as it gives the illusion to the brain that the amputated limb is still intact. Electrodes are connected to the amputated limb and it records the muscle signals, which are then converted into movement of the virtual limb on the patient's screen. The patient can then perform exercises as well as fun games, which makes this therapy much more engaging compared to the other methods. What makes this unique for mirror therapy is the system can use signals from the damaged limb itself, so it can be used by bilateral amputees where mirror therapy cannot. In a recent study done, 4 of the 5 patients found dramatic pain relief for days at a time.